Section: Introduction. In this section, we engage in a multifaceted exploration of medicine. Our daily tasks as clinicians involve crucial patient consultations where effective communication of diagnoses, treatment plans, and empathy is vital for establishing trust. Handling complex cases requires a deep understanding of patient history in electronic medical records, as well as reasoning from medical images and other diagnostics. To make informed decisions amidst uncertainty, we must keep up with the latest medical information from various reliable sources, ranging from research papers to procedural videos. The art of delivering care relies on our ability to engage in advanced clinical reasoning, synthesize complex information from diverse sources, and collaborate with fellow clinicians to support patients on their healthcare journeys. While artificial intelligence (AI) systems can aid in individual medical tasks and show promise in multitask medical applications, enhancing their reasoning and understanding capabilities could lead to more intuitive and beneficial tools for both clinicians and patients. Recent advancements in large language models, LLMs, and large multimodal models, LMMs, like GPT-4, PaLM, and Gemini have demonstrated the effective encoding of clinical knowledge and impressive performance in medical question-answering tasks, even for complex cases requiring specialized knowledge. However, their real-world utility is still a work in progress due to the unique nature of medical data and the critical importance of safety, which call for specialized fine-tuning and alignment of these models. Medically fine-tuned LLMs can provide detailed answers to complex medical questions and even outperform physicians in certain aspects. LMMs have shown comparable performance to radiologists in generating radiology reports and excelled in diagnostic consultations with patient actors. Despite these advancements, there is room for improvement in clinical reasoning, handling uncertainty, and collaborating effectively with clinicians. The ability to process complex multimodal medical data, such as integrating images, videos, and health records, remains a challenge for current models. Enhancements in performance not only benefit medical applications but also have broader implications. Developing tasks and benchmarks to evaluate medical illness progress can have a significant impact. The Gemini models, a new generation of highly capable multimodal models, show promise in addressing key challenges in medical AI with their innovative architecture and training data. By building on the strengths of the Gemini models, we introduce MedGemini, a family of models tailored for medicine. While the concept of generalist medical AI models is intriguing, we focus on creating specialized models optimized for different capabilities and scenarios, taking into account factors like training data and computational resources. MedGemini inherits Gemini's foundational abilities in language processing, multimodal understanding, and long context reasoning. Through enhancements like web search integration and uncertainty-guided search strategies, our models achieve state-of-the-art performance in clinical reasoning tasks. We meticulously evaluate the quality of our models on various medical benchmarks and demonstrate their effectiveness in tasks such as medical note summarization and clinical referral letter generation. Additionally, our models excel in multimodal tasks and showcase strong long-context reasoning capabilities, proving valuable in analyzing complex medical data like electronic health records and videos. The advancements of MedGemini hold great promise in the medical field, emphasizing the need for thorough validation before widespread deployment. Section Summary. In this section, we introduce MedGemini, a new family of multimodal medical models built upon Gemini, showcasing advancements in clinical reasoning, multimodal, and long context capabilities. We evaluate MedGemini across 25 tasks on 14 medical benchmarks, achieving state-of-the-art results on clinical language tasks with a 91.1% accuracy on MedQA, USMLE, using an uncertainty-guided search strategy. Additionally, MedGemini demonstrates strong performance in multimodal tasks and long-context reasoning, showing promise for real-world applications in medical note summarization, clinical referral letter generation, and EHR question answering. Section: Methods. In this section, we present our methods. We have developed a range of models within the Gemini ecosystem that vary in size, encoder types, and architectures. These models have been trained on diverse high-quality data from various modalities and have achieved state-of-the-art results across different benchmarks such as language, reasoning, coding, multilingual tasks, as well as image and video tasks. One of our key models, the Gemini 1.0 Ultra, excels in language tasks that involve complex reasoning. The Gemini 1.5 Pro model, on the other hand, is capable of efficiently handling long context inputs and multimodal inputs like videos and audio. For on-device efficiency, we have the smallest model variant, the Gemini 1.0 Nano. To cater specifically to medical tasks, we have developed the Med Gemini models by leveraging the capabilities of the Gemini family. We have focused on enhancing advanced reasoning through self-training and web search integration. For tasks requiring less complex reasoning, we introduced the Med Gemini M1.0 model by fine-tuning the Gemini 1.0 Pro model. For more advanced reasoning tasks, we introduced the Med Gemini L1.0 model by fine-tuning the Gemini 1.0 Ultra model using a self-training method that enables efficient web search utilization. In addition, we have implemented strategies to improve performance on complex clinical reasoning tasks, such as a novel uncertainty-guided search strategy during inference. We have also worked on enhancing multimodal understanding by fine-tuning models and using customized encoders to adapt to the unique requirements of medical modalities. For tasks involving long context processing, we have utilized a chain of reasoning technique and developed inference time strategies to better understand lengthy electronic health records, EHRs. Clinical reasoning is crucial in healthcare, involving the integration of clinical knowledge with patient information to reach a diagnosis and treatment plan. We aim to enhance the clinical reasoning abilities of our models by incorporating up-to-date information from web sources and fine-tuning them on medical datasets like MedQA. Our goal is to improve the model's ability to generate accurate answers by making effective web search queries and integrating the retrieved information into the reasoning process. By addressing these challenges, we aim to enhance the clinical reasoning capabilities of our models for diverse medical scenarios. Section Summary. In this section, we introduce the Gemini ecosystem, which includes a range of models trained on diverse high-quality data across various modalities, achieving top results in language, reasoning, coding, and multimodal tasks. We focus on developing Med Gemini models by fine-tuning Gemini models to enhance advanced reasoning through self-training and web search integration, improve multimodal understanding with customized encoders, and optimize long context processing using chain of reasoning techniques. Our goal is to enhance clinical reasoning by integrating up-to-date information from web sources and improving the model's ability to generate accurate answers through fine-tuning, as demonstrated by the Med Gemini L1.0 model. Section: Fine-tuning datasets for language-based tasks. In this section, we fine-tune datasets for language-based tasks. We find it challenging to gather expert demonstrations of clinical reasoning, especially how experts utilize knowledge retrieval tools like web search. To address this, we create two new datasets using self-training. The first dataset, MedQAR, Reasoning, expands on MedQA by including synthetic reasoning explanations called chain of thoughts, COTS. The second dataset, MedQARS, Reasoning and Search, builds upon MedQAR by incorporating instructions to use web search results to enhance answer accuracy. To diversify the fine-tuning data for Med Gemini L1.0, we introduce a long-form question-answering dataset with expert-crafted responses from Health Search QA, Live QA, and Medication QA, as well as a medical summarization dataset with clinician-written summaries from Mimic 3. These additions aim to enrich the training data for language-based tasks. We implement a self-training framework with search inspired by successful synthetic data generation methods. This framework focuses on creating high-quality synthetic examples of clinical reasoning with the use of web search. We generate two reasoning paths, or COTS, for each training question, one without external search information and one that integrates search results during COT generation. Our self-training process involves prompting Gemini L1.0 to generate search queries for each question, retrieving search results, and curating expert demonstrations of clinical reasoning. We then use these components to generate COTS, fine-tune the model, and iteratively improve its reasoning and search integration based on expert demonstrations. Additionally, we introduce an uncertainty-guided search process during inference to enhance the model's performance. This iterative search process involves generating multiple reasoning paths, measuring uncertainty based on answer choice distribution, generating search queries to resolve conflicts, and retrieving search results to augment the model's input prompt. By incorporating uncertainty-guided search at inference, we aim to improve the quality of Gemini L1.0's responses. Section Summary. In this section, we introduce two novel datasets, MedQAR and MedQARS, aimed at improving clinical reasoning by incorporating self-training methods. We implement a self-training framework that generates high-quality synthetic examples of clinical reasoning with web search integration to enhance model performance. Additionally, we design an uncertainty-guided search process during inference to refine model generations by leveraging search results based on the Shannon entropy of answer choice distributions. Section: Multimodal Understanding via Fine-Tuning and Customized Encoders. In this section, we specialized Gemini's multimodal reasoning and conversational abilities for the medical field by fine-tuning it with domain-specific tasks. We used 8 tasks from 6 datasets, including image-to-text tasks like visual question answering in radiology and pathology, radiology image captioning, and dermatology image classification. We fine-tuned Gemini 1.5 Pro for each task by providing specific instructions. This resulted in the creation of Gemini M1.5. We also enhanced Gemini's capabilities by adding new modality encoders to process various health-related signals like data from wearables, genomic information, nutritional data, and environmental factors. As an example, we developed Gemini S1.0 by incorporating a specialized encoder to handle raw ECG waveforms for close-ended question-answering tasks. Furthermore, we explored the use of long context processing for medical applications using Gemini M1.5. We focused on tasks such as retrieving specific information from lengthy EHR notes and understanding medical videos. To improve information recall and reasoning, we employed different prompting strategies and chain of reasoning techniques. For the task of long EHR understanding, we addressed challenges such as vocabulary inconsistencies, heterogeneous data structures, and contextual influences on interpretation. We curated a set of complex EHR cases and formulated a search retrieval task for subtle medical problems. By utilizing a two-step chain of reasoning approach, we evaluated Gemini M1.5's ability to retrieve and reason about rare conditions accurately from long EHR records. Section Summary. In this section, we fine-tune Gemini for medical tasks using domain-specific instructions and datasets, including image-to-text tasks like radiology image captioning and dermatology image classification. We also enhance Gemini's capabilities by integrating various health-related signals like wearable data, genomics, and environmental factors, and develop specialized encoders for processing raw biomedical signals such as electrocardiograms. Additionally, we evaluate Gemini's performance in processing large amounts of medical information for tasks like retrieving clinically relevant details from lengthy electronic health records and understanding medical videos through prompting strategies and chain of reasoning techniques. Section: Instruction Prompting for Medical Video Understanding. In this section, we delve into the realm of medical video understanding. We are actively exploring how AI can comprehend surgical and procedural videos in the medical field. The progress in computer vision technologies like semantic segmentation, object detection, and action classification has paved the way for various clinical applications such as recognizing different surgical phases, detecting and tracking tools, and even assessing surgical skills. However, Existing models have struggled with capturing long-range dependencies and intricate relationships within videos due to limited context windows. Our model, Gemini M1.5, stands out with its unique long context capability, offering a potential breakthrough in understanding medical videos. By analyzing entire video inputs, it can identify visual patterns and comprehend actions and relationships across extended time frames. To facilitate the understanding of medical videos by Gemini M1.5, we utilize zero-shot prompting with task-specific instructions. This approach involves providing the model with specific guidance to help it analyze language queries and video content effectively, enabling it to perform tasks like localizing relevant visual segments or identifying surgical views in videos for assessment purposes. We evaluate the performance of Gemini through various benchmarks covering text-based reasoning, multimodal capabilities, and long context processing tasks in the medical domain. For instance, we assess its medical reasoning abilities on text-based tasks using datasets like MedQA, NEJMCPC, and Gene Turing. We also conduct evaluations on multimodal visual question answering tasks across different medical specialties to gauge the model's performance comprehensively. Furthermore, we explore challenging use cases that demand long-form text generation, such as medical summarization, referral letter generation, and medical simplification. These tasks require the model to generate structured summaries, referral letters, and plain language summaries from complex medical information, showcasing its versatility in handling diverse medical scenarios. Through expert evaluations and comparisons with human experts, we aim to demonstrate the capabilities of Gemini in various medical applications. It is essential to note that while our model shows promise in tasks like medical diagnostic dialogues in dermatology and radiology, further research and validation are crucial before considering its deployment in critical scenarios like diagnostic assistance for clinicians. Section Summary. In this section, we explore the application of Gemini models for medical video understanding, leveraging long context capabilities to identify visual patterns and relationships in videos. We employ zero-shot prompting with task-specific instructions to enable the model to perform tasks like medical visual answer localization and critical view of safety assessment in surgical videos. Additionally, we evaluate Gemini's performance in text-based reasoning, multimodal visual question answering across various medical specialties, and long context processing tasks, showcasing its capabilities in medical AI. Section: Evaluation of long context capabilities on video and EHR tasks. In this section, we assess the performance of our model, Gemini M1.5, on tasks involving long context understanding in both video and electronic health record (EHR) domains. In the EHR task, we create a task called Mimic 3 Needle in a Haystack, where the objective is to find relevant text sections related to a specific medical issue in a large set of clinical notes and determine if that issue is present. We compile 200 examples, each containing a set of de-identified EHR notes from 44 ICU patients with extensive medical histories. The examples are chosen based on patients with over 100 medical notes, excluding structured EHR data. Each example ranges from 200,000 to 700,000 words, with the medical condition mentioned once. The ground truth label for each example indicates whether the medical problem is present, determined by a majority vote of 3 physicians. Out of the 200 test examples, 121 are positive cases and 79 are negative cases. We compare the performance of Gemini M1.5 with a baseline method in terms of precision and recall. In the video task, we evaluate Gemini M1.5's ability to understand long context in video question answering using 3 medical video tasks, 2 tasks involving medical visual answer localization, MVAL, using the MedVidQA dataset, and the critical view of safety, CVS, assessment task on the Colic 80 CVS dataset. The MVAL tasks aim to identify specific video segments based on natural language descriptions given a video input. We use metrics like intersection over union, IOU, and mean IOU, MIOU, to evaluate the model's performance in predicting video spans. Additionally, we assess the model's capability in evaluating the critical view of safety, CVS, method in laparoscopic cholecystectomy videos to prevent bile duct injury, BDI. We analyze the CVS assessment task on the Colic 80 dataset and Colic 80 CVS video clip annotations to predict which CVS criteria are met in each video clip. Overall, we demonstrate that MED Gemini M1.5 excels in advanced reasoning, multimodal understanding, and handling long context information across various medical tasks. Our evaluations cover a wide range of benchmarks, showcasing the model's potential for real-world applications such as medical summarization, multimodal conversations, and surgical video comprehension. Section Summary. In this section, we evaluate the long context capabilities of our model on both video and electronic health record, EHR, tasks. For the EHR task, we create a task called Mimic 3 Needle in a Haystack to retrieve relevant medical information from a large collection of clinical notes and determine the presence of a medical condition. Additionally, we assess the model's performance on video question answering tasks, including medical video tasks like medical visual answer localization, MVAL, and the critical view of safety, CVS, assessment in laparoscopic cholecystectomy videos, showcasing its ability to understand complex medical scenarios. Section: Ablation Analysis. In this section, we analyze the impact of self-training and uncertainty-guided search on the performance of MED Gemini L1.0. By comparing its performance with and without self-training, and varying rounds of uncertainty-guided search for MED QA, USMLE, we observe significant improvements. Adding self-training boosts accuracy by 20%, and each round of search enhances performance up to 15%. For the NEJM-CPC benchmark, incorporating search during inference leads to a 22% increase in top 10 accuracy. We also present results for NEJM-CPC categorized by 4 specialties. We then address issues in the MED QA, USMLE test set, such as missing information and outdated answers, by conducting a complete relabeling. After re-annotating questions with input from U.S. physicians, we identify questions with missing information, label errors, and ambiguity. Removing these problematic questions significantly enhances accuracy. Filtering out uncertain questions based on majority agreement further improves accuracy. Next, we showcase MED Gemini M1.0's ability to generate detailed text for various medical tasks, including clinical summaries, referral letters, and medical simplification. Clinician ratings indicate that the model's responses are on par or better than expert responses in more than half of the cases. Our MED Gemini models excel in diverse medical multimodal tasks, either outperforming or competing with state-of-the-art methods across 7 benchmarks. Notably, MED Gemini L1.0 achieves state-of-the-art performance in 3 challenging tasks, surpassing GPT-4v by significant margins. Similarly, MED Gemini M1.5 and MED Gemini S1.0 outperform previous models in various tasks, showcasing the model's versatility and effectiveness across different medical domains. Section Summary. In this section, we conduct an ablation analysis to evaluate the impact of self-training and uncertainty-guided search on the performance of MED Gemini L1.0 across different medical benchmarks. We observe significant performance improvements with self-training and each round of search, particularly in MED QA, USMLE, and NEJM-CPC benchmarks. Additionally, we address concerns in MED QA, USMLE, by conducting a complete relabeling of the test set, which leads to improved accuracy by filtering out questions with missing information or label errors. Furthermore, MED Gemini models demonstrate strong performance in generating long-form medical text and exhibit multimodal understanding across various medical tasks, outperforming or competing with state-of-the-art methods in 7 medical multimodal benchmarks. Section: Preview of multimodal dialogue capabilities. In this section, we present a preview of the capabilities of multimodal dialogue using our model, MED Gemini. we showcase how Gemini can be applied in real-world scenarios through hypothetical medical dialogues in dermatology and radiology. In the dermatology dialogue example, a user asks about itchy lumps on their legs and arms. Our model, Gemini M1.5, requests an image of the lumps from the user, analyzes the image, provides a diagnosis of prurigo nodularis, and suggests potential treatment options. In the radiology dialogue example, Gemini M1.5 interacts with a primary care provider to analyze a chest X-ray, CXR, identify degenerative disc disease, discuss causation versus correlation regarding back pain, recommend further investigations, and communicate findings in simple language for patient understanding. We note that Gemini M1.5's responses may vary based on the input prompt. While we do not provide a detailed quantification of its dialogue capabilities in this work, these examples demonstrate its potential to facilitate discussions on medical topics using various information sources, which could be valuable for interactions between users and AI systems or clinicians. Furthermore, we assess Gemini's ability to process long medical records and videos effectively. We evaluate its performance in identifying rare medical conditions in lengthy electronic health records, EHRs, and medical videos, showing promising results compared to baseline methods. Additionally, Gemini M1.5 achieves state-of-the-art performance on specific medical video tasks, surpassing other models that require extensive customization. We acknowledge limitations in accessing certain YouTube videos for evaluation. Looking ahead, there is potential to enhance video understanding by optimizing the utilization of multimodal data. While Gemini M1.5 outperforms GPT-4 volts in a surgical video assessment task, there is room for improvement compared to a supervised baseline using a ResNet 3D architecture. Further exploration of prompting strategies and fine-tuning instructions could enhance the performance of our models in such tasks. Section Summary. In this section, we preview the multimodal dialogue capabilities of Gemini by showcasing its potential in real-world scenarios through hypothetical medical dialogues in dermatology and radiology. We demonstrate Gemini's ability to engage in conversations, provide accurate diagnoses, recommend treatments, and facilitate patient understanding using non-technical language. Additionally, we evaluate Gemini's long context processing capability on tasks involving long electronic health records, EHRs, and medical videos, showcasing its effectiveness in identifying rare medical conditions and outperforming existing models in certain tasks. Section: Applications of long context capabilities in biomedicine. In this section, we explore the applications of long context capabilities in biomedicine. We discuss how these capabilities can be beneficial in medical education, improving clinician interaction with electronic health record (EHR) systems, and aiding in biomedical literature review and summarization. We showcase the potential of long context capabilities in various scenarios. For instance, we demonstrate how our model, Gemini M1.5, can identify surgical actions in videos, which can enhance surgical training, optimize operating room efficiency, and guide surgeons during complex procedures for better outcomes. Furthermore, we illustrate how Gemini M1.5 can analyze surgical video dialogues, providing valuable insights for clinicians and students. These capabilities could improve patient safety, enhance medical training, and assist in surgical procedures by offering educational aids and in-procedure guidance. Additionally, we show how our model can parse extensive medical records and generate clear summaries of active and historical conditions. This feature can reduce cognitive load for clinicians and patients, making complex medical information more accessible and improving overall efficiency. Moreover, we highlight the ability of Gemini M1.5 to process research articles on specific genetic loci, such as the FTO gene's association with obesity. By summarizing complex genetic information from multiple sources, the model can aid researchers and clinicians in understanding the latest findings in genomics and other biomedical research fields. Section Summary. In this section, we explore the applications of long context capabilities in biomedicine. We showcase how these capabilities can enhance medical education, improve clinician interaction with electronic health record systems, and aid in surgical video analysis for training and real-time guidance during complex procedures. By demonstrating the potential benefits in surgical care, education, and patient safety, we highlight the promising role of long-context capabilities in providing valuable tools for clinicians and researchers in various biomedical settings. Section: Discussion. In this section, we discuss the advancements of Gemini in clinical reasoning, multimodal understanding, and long-context processing in the medical field. We have observed strong performance across 25 tasks in 14 medical benchmarks, covering various areas such as medical knowledge, clinical reasoning, genomics, waveforms, medical imaging, health records, and videos. Our Gemini L1.0 model has achieved a new state-of-the-art performance on the MedQA USMLE benchmark through self-training-based fine-tuning and search integration. By carefully examining the MedQA test set, we have identified some important insights, including missing information in about 4% of the questions and potential labeling errors in 3% of them. It is crucial to recognize the limitations of benchmarks like MedQA USMLE due to challenges in establishing definitive ground truth in the medical field. We have also integrated web search capabilities into Gemini to enhance the accuracy of medical query responses. While our results on various benchmarks are promising, further research is needed to explore restricting search results to authoritative sources, using multimodal search retrieval, and assessing the accuracy and relevance of search results. The multimodal conversational abilities of Gemini M1.5 are noteworthy as they enable natural interactions without specific medical dialogue fine-tuning. These capabilities have the potential to facilitate clinical dialogues, request additional information, explain reasoning clearly, and assist in clinical decisions while deferring to human experts when necessary. One of the key strengths of Gemini is its long context processing capabilities, which allow for the identification and verification of information in lengthy electronic patient records. This capability can significantly reduce cognitive load for clinicians by extracting and analyzing crucial information efficiently. Furthermore, these capabilities extend to tasks like medical video question answering and annotation, showcasing the potential for complex multimodal data analysis. Overall, the long context processing abilities of Gemini open up new possibilities for fine-grained analysis of various medical data types and integration with health records to improve clinical workflows. Further exploration is needed to fully understand the potential of Gemini in clinically specific tasks such as radiology report generation. Section Summary. In this section, we discuss the significant advancements showcased by Gemini in clinical reasoning, multimodal understanding, and long context processing within the medical domain. Gemini L1.0 achieves a new state-of-the-art SOTA on the MedQA USMLE benchmark, highlighting the importance of self-training based fine-tuning and search integration. The integration of web search with Gemini presents exciting possibilities for providing more accurate medical answers, while its multimodal conversational capabilities and long context processing open up new frontiers for medical AI systems. Section: Importance of medical specialization and fine-tuning. In this section, we emphasize the significance of medical specialization and fine-tuning for Gemini models. These models excel in handling multiple types of data and possess extensive medical knowledge due to their large-scale pre-training. This is evident in their exceptional performance on various multimodal benchmarks, such as the NEJM Image Challenge, where they outperform more general vision language models like GPT-4v by a significant margin. However, medical data, especially multimodal data, is intricate and distinct, not commonly found on the internet where typical language models are trained. While Gemini models serve as a robust foundation, further refinement, specialization, and alignment are crucial before deploying them in the medical field. Despite the advanced capabilities of Gemini models, the amount of data required for their specialization and alignment is notably lower compared to earlier generations of medical AI systems. This study demonstrates the efficient adaptation of such models to novel and critical medical modalities like ECGs. It is essential to conduct thorough evaluations beyond standard benchmarks to assess the true potential of these models in real-world medical applications. Our research represents a comprehensive evaluation of medical language and multimodal models, showcasing their new capabilities and practical utility in tasks like medical summarization and referral note generation. While diagnostic tasks are essential in research, they come with regulatory, clinical, and equity-related challenges that must be addressed before implementing them in real-world settings. Generative AI models are more commonly used in non-diagnostic tasks within healthcare, offering opportunities to enhance the efficiency of healthcare providers by streamlining administrative tasks and aiding in information retrieval and synthesis. As we explore the capabilities and enhancements of Gemini models, it is crucial to integrate responsible AI principles throughout the model development process. This includes considerations of fairness, privacy, equity, transparency, and accountability. Privacy measures should align with existing healthcare regulations to safeguard patient information, while fairness concerns must be addressed to prevent the amplification of historical biases and disparities in healthcare AI systems. A deep analysis of the intersectional impact of these models is necessary, considering factors such as gender, race, ethnicity, socioeconomic status, and other sensitive attributes. The evolving capabilities of language and multimodal models offer opportunities to address prior issues and enhance accessibility across various healthcare scenarios. However, thorough evaluation frameworks are needed to assess and mitigate potential biases and unfair outputs in complex real-world use cases. By incorporating responsible AI practices and engaging with experts in the field, we can ensure the safe and effective deployment of these advanced models in clinical settings.